Our next speaker is Dr. Homero Rivas, coming to us from Stanford University, where he's an assistant professor of surgery, and he's going to discuss how do we talk about poem with patients as well as other physicians. Homero?
Very good. Thank you. And I'm just going to take the liberty of recording our session, and this is going to come as an example of how we can educate patients. I just need my presentation up. Thank you. Well, this is a very innovative procedure, as we all know. This is something that sometimes is very difficult for us to actually describe to other physicians and patients. As a matter of fact, oftentimes it's more difficult to explain it to physicians because it's such a new way of how we actually find what we have been doing the last so many years in a very different way. And what we have found is that you really have to rely on novel communication technologies so you can actually educate other people. And I guess this is what's failing this time. And we went through this like some time ago. So next year, probably we can give the presentation out of glass. And that's what I have today. Do you have any updates? There you go. Very good. And so that's it. I have nothing to disclose. And we have this problem. It's a very uncommon disease. So even digestive surgeons, we have a difficult time sometimes in seeing enough patients, enough flow of patients. So to come up with ways that we can actually teach this can be a little challenging just on experience. As we have heard, this is a highly specialized procedure, and just a few places they will be able to actually perform this. The traditional ways how we educate are places like this, and I commend everyone for being here. This is a national meeting where we actually take some time off from our work, our busy practice, losing some money or losing some time with family just to come and learn some things. But it can be just challenging the more and more we do things to actually keep going to all these numerous congresses. We also have CME activities, things online, etc. But there are non-traditional ways how we can actually educate and transfer knowledge. And especially nowadays, most of the patients we have, they're highly, highly involved with their disease. They actually learn so much by reading so much, by talking to other patients so much that when they go to clinic, they seem so empowered that they actually feel like they know more about you about this thing. So you have to be in par with them, and you need to be aware of the opportunities that there are for them to learn about things. The proposed strategies that we have when we have something new is to present this through conventional ways, the meetings, grand rounds, just doing some teaching rounds, publications, etc. But all of those will actually take quite some time before we actually get some type 1 evidence to present to the world. And so what other people have done, and it has been highly, highly successful in many different things, is to use what we have as far as social media and have many different ways how we can actually bring this to the world right away in an immediate fashion, and we can empower people with that information so they can understand better about what poem is, how safe it is, and how it perhaps may be the most optimal way how to take care of most patients with achalasia. The efforts have been implemented right away. This is an effort that Professor Inoue started with some help from others by implementing a website that has extremely great detail, and probably most of the people who have been doing poem have visited and have contributed to the website, where you can actually have all the information, highly technical information and informations for patients and for referring physicians. And it just shows like a small video clip where in so many different segments you can actually see what it entails, so you can explain right away to, for example, a radiologist who's never seen a swallow study after a poem technique, how they can actually, what they're actually looking for, and that can be highly beneficial, and you can actually have that in your cell phone and your mobile phone of anything. Probably these diagrams have been utilized by all of us doing, giving lectures for achalasia. And that's just a way how we can actually, expose this to others, the meaning of poem. With no question, in medicine, especially in comparison to other fields, storytelling has a very powerful impact with patients. And patients are their own advocates to come and explain about their experience when it comes to an innovative procedure. We see that in the case of notes, in the case of poem, this has been of fantastic, fantastic help, because patients, and I guess I could put like 100 videos for all the different people who have been doing poem, but we can actually give the experience that those patients have to others so they can learn about the benefits of this technique. With no question, this goes along with the use of what we call social media and mobile health. This is going to be the next revolution in medicine. We have a surplus of patients. We have a lack of primary care physicians, for surgeons in many ways, and we can actually, by use of mobile phones, laptops, online access, we can actually get access to care to many people. And this is something that actually patients learn a lot, as much from the physicians, they learn as much from other patients, but by visiting and creating networks. This is also a well-established community platform that it's online for patients just for achalasia, and most of them, this is for poem. And this is how I get lots of referral patients that happen to read about the techniques of Professor Inoue, and they happen to be in Northern California, and that's how we recruit these patients, and that's how we also refer other patients to some of you. There's also a very, I would say, strong group that it's on Facebook, that it's for achalasia and esophageal motility disorders. Some of these people, sometimes you really wonder about who's treating them. Sometimes you listen about their doctors and how well trained and prepared they seem to be, but some other times there's a great abundance of ignorance among physicians in the sense of what poem is and what it represents and how it could impact in their practice. So because of the presence of this, we are as much responsible, and I think we need to have some involvement in such platforms so you can, oh my God, so we can make them better. Should I close the program? Anyway, just like, let me see if I have access.
Doctor, we apologize. The computer has crashed your presentation. We are reloading your presentation.
Yes, thank you. I'm actually doing it myself. Very good. So there's already a Twitter channel for this. And I just, I should advise everyone to actually be very proactive with this. This is a fantastic way how actually you can promote serious educated knowledge among other physicians, among patients, so we can actually make this a reality. So at some point, believe it or not, it will have some impact as much as publications would have, even on policymakers for insurance purposes. There's other websites. This is very, very popular, especially in the Bay Area, as far as patients with very weird, non-common problems, something called Patients Like Me, where actually patients can sign up for free, and they get, for example, in the case of achalasia, they have to go through all their symptoms, all their problems that they have had, so they can manage a profile, and they can get online to act with other patients, and you can actually see very detailed demographics as far as who is the one who has achalasia, who are the ones who have had a hilar myotomy, who are the ones who have had poem, etc. And these are ways how actually at some point people have envisioned to even do demographic studies that can be very serious and publishable. There's some people who have disrupted the way we do education. There's the Khan Academy, where you actually can do your own learning by watching videos. And in the same way, we have been working extensively with massive open online courses at Stanford. We have probably the largest one in medicine, and this is one that we have 15,000 registered students throughout the world about the use of mobile devices to actually implement in health. So all these are very good ways how you can do this. This is just a last example. This is a small startup where they do video scripts. And so we're implementing this as well, where we have actually uploaded lots of very short video clips. They shouldn't be more than like a minute, so patients won't get bored and they would actually sit through them. And you can actually give a prescription of a video where they can actually just get a QR code with their phone and go straight into their video library, and they have to watch all the videos from the dietitian, my explanation, the explanation about what's going to happen, all those things. And we, on the back end, we get an analytics of the way that patients actually, if they actually were engaged or not into this conversation. Anyway, to conclude this small talk, I just want to say there are more than just the formal ways that we can actually transfer knowledge, especially in medicine. There are many novel, innovative ways, just as innovative as Poem is. There are innovative ways that we can use for very little cost and that would allow us to bring someone to you by using those mobile technologies. One very interesting way, and we're using actually Glass for this, Google Glass, is to have in the operating room, we can actually flash it into a QR code and we can have augmented reality of how to do a procedure. So in that sense, if I'm doing my first few poems, or if my fellow is doing a first-time poem, he can actually flash it and he can actually see a poem being performed and exactly what is that he needs to do. That's kind of like having a cheat sheet. The other way how you can implement it, Professor Inoue doesn't have to travel all the way from Japan just to see me doing this. I can actually transmit the operation, the poem itself, and he can comment to me in privacy, this is what you're doing right, this is what you're doing wrong. Anyway, with no question, we need to bring awareness of the fact that poem exists, that achalasia, for achalasia is perhaps the best treatment, and that we should, jointly with gastroenterologists and surgeons, take care of this. I thank you, the committee, for inviting me, and thank you everyone for the attention. Thanks.